All right, so today we're diving into a really fascinating topic, the relationship between artificial intelligence and mental health care. Now, this is a field that is just brimming with potential, but as we're about to see from a recent review, it's also running into some very, very human roadblocks.
So, to really get this, you have to start with the problem AI is trying to solve. Our healthcare systems, as you probably know, are just stretched to the limit. And that leads to this thing researchers call missed care, basically a gap where patients' real emotional and psychological needs just fall through the cracks.
And look, this isn't just about efficiency metrics on a spreadsheet. We're talking about clinician burnout, talented, dedicated people being pushed to their absolute limit. And that has very real consequences, both for them and for the patients they're trying so hard to help.
Okay, so with that pretty serious problem on the table, we get to the big question. Can technology actually step in and help carry some of this weight?
And this is where the big idea comes in, the AI-powered Decision Support System, or DSS. You can think of it as a smart assistant, something designed to help clinicians process all that data, spot things they might otherwise miss, and hopefully prevent that missed care from ever happening.
But here's the thing. How much do we actually know about how these tools work in the real world? Well, researchers recently took a look. They started by casting a super wide net, and they found 259 studies that seemed to be on topic.
But get this, once they started screening them for actual relevance, that number took a nosedive, all the way down to just 46.
And from that small pile, when they applied all their criteria, they were left with just 4. 4 studies. That's it. This just goes to show you how incredibly early we are in this whole game and how little we really know about AI's impact out in the wild.
So what did they find in those few precious studies? Well, it turns out one theme just kept coming up over and over as the single biggest hurdle. And this is the kicker. The biggest barrier wasn't the tech. It wasn't buggy software or weak algorithms. The main problem was deeply human. Could these highly trained clinicians actually bring themselves to trust what the AI was telling them?
Now, to be fair, it's not all doom and gloom. Some studies showed decent numbers, 60 or 71% of clinicians saying they had confidence in the tool. But that still leaves a huge chunk of experts who are skeptical, and that's a trust gap you just can't ignore.
So, to really understand that gap, we've got to talk about this concept that's at the heart of so much AI, the black box.
A black box AI is kind of like a magic trick. It gives you an answer, but it refuses to tell you how it did it. It can't show its work. And for a doctor or a therapist whose decisions affect real lives, that's a huge problem.
So the alternative, and what pretty much everyone in the field is pushing for now, is a glass box model. This is an AI that's built from the ground up to be transparent, so the clinician can see exactly why the system is making a certain recommendation.
And here's a twist in the research that is just so interesting. One of the studies found that clinicians who already had experience with these AI tools were actually less likely to follow their advice. You'd think familiarity would breed confidence, but nope, in some cases it was breeding more skepticism.
And you know what? It turns out that skepticism is totally justified, because another study found that when clinicians did engage with bad AI advice, their own accuracy, their own expert judgment actually got worse. So the tool wasn't just useless, it was actively making things worse. Okay, so we've established the problem is trust. The big question is, what's the solution? How do we fix this? Well, the research points to a really clear path forward.
And the answer isn't just about writing better code. It's about a totally different, more human-centered process. And it really comes down to 3 key pillars.
First up, you have to bring the clinicians in from day one. From the absolute beginning of the development process. When they help build the tool, you end up with something that actually respects their autonomy and fits how they really work. Second, and this ties right in, is demanding transparency. That means building those glass box models. And third, you have to design the interface itself to show that transparency. Little things like telling the user how confident the AI is in its own answer, or giving multiple options instead of just one right answer.
So all of this, it all builds to what is probably the single most important takeaway from all this research.
Look, the point of all this tech isn't to replace doctors and therapists. The goal is to build a tool that a clinician can rely on, something that empowers their expertise and makes them even better at what they do. Success isn't a smart algorithm, it's a useful tool.
And this quote just nails the shift in thinking we need.
It's not about asking a clinician to trust an AI like a person. It's about the AI having to earn its keep by proving it's reliable, time and time again. The burden of proof is on the developers, not the users.
So, I'll leave you with this to think about. As this technology gets more and more powerful, what's going to matter more in the end? The raw performance of the algorithm itself, or the strength of the human partnership we managed to build around it?